I'm Jim Plasky, Family Nurse Practitioner. I just want to welcome you to my new YouTube series as well as podcast, if that's how you're tuning in. My goal in creating this space is to discuss education, health, and other topics that will help enrich your clinical practice. Whether you're an undergrad thinking about going into healthcare, or maybe you're a graduate student that's already working on becoming a PA or an NP, or even those of you that have been practicing for years are welcome. I want us to be able to have a space where we can hone our clinical skills and procedural practices. My hope is that you're able to take something away that's going to change your practice or change the way that you look at procedures moving forward. Plasky and Associates is the LLC that I've created, and it's been a dream of mine for a long time. It's a platform where I'm able to launch educational products to help bridge that gap from textbook to practice. And some of the molds that I've created with this LLC help to enrich dermatology procedures and where we can just come together to practice punch biopsies, shave biopsies, elliptical excisions, mole removal. I even added some skin tags on there that we can practice taking those off. When I was looking at products and things that I would want to change in my own practice, I reflected on all of the students that I've been with over the last few years, and the gaps that I was seeing when I was educating on procedural techniques. These are all products that I wish I had when I was going into practice or I was going in through my grad program. So I want this to be a space where we can grow as a team. Various other ailments that I want to include, and I'm actually in prototypes with, are INDs, a more comprehensive suture pad that's going to give us the ability to do subarticular stitches, as well as looking at some of that adipose and how do we get around some of that with our techniques. These are just some of the few opportunities that I want us to be able to practice together. As a nurse practitioner, I've been in family medicine, and that's where I'm certified. I've been a primary care provider for over 5 years. And during that time, over half of it has been in a rural setting where I was the only clinician on site. In addition to the day to day chronic care management and continuity of care, where I was seeing 3 day olds all the way to 95 plus year olds, my certification allows me ample variety with patient populations from all walks of life. Aside from that, there would always be that walk in patient that would come in with needing a laceration repaired, or maybe just fell during practice or in the field. Now we're dealing with x rays and casting or splinting in most cases, and just other acute care urgencies. And so we did function a lot as an urgent care in addition to a primary care site. Now I'm predominantly working as an urgent care provider because of the piece of just loving the procedural side of things and that fast paced nature of acute care treatments. It's not uncommon that I do anywhere from 30 to upwards of high 40s a day with patient treatment plans and just doing visits with these clients. This drive, I think, grew from my passion as a nurse, where right out of school, I wasn't sure where I wanted to go. And one of the great things when it comes to nursing is we don't have to be sure. There's always going to be a space where we can venture into a new specialty, a new arena, and try our hands at something new. This is one of the only career paths that allows a full change, especially with those that are becoming burnt out or those that just want a new challenge. And I found that in the operating room. I became trained as a first assist for Da Vinci procedures in general surgery, and I loved every minute of it. I then went into admin for a short time, working at quality metrics for surgical cases. And then I was completing my graduate degree at that same time. I always knew that the family nurse practitioner role was my goal. And I knew that I wanted to get there in a way that I not only had clinical experience to grow upon, but then also had that piece of proceduralist on an outpatient side that I can contribute to that career field. Whether you're tuning in for the first time or you're interested in learning more, stay tuned as I hope to bring some great topics to this platform that will help launch additional practice changes. My goal is to make a change and make a connection from textbook to practice. Hit that like button. Please subscribe to our growing community of care providers and stay tuned for up and coming videos. Thank you.